this is Amanda LaPlante. You're listening to Get Real to Heal on KWRHLP 92.9 FM. I am here today with Dr. Seth Gerlach of Core Health. How are you?
I'm great, Amanda. Thanks for having me on today. This is exciting. So fun to be here.
Yeah, definitely. I'm so glad that you could come on. You do something in your practice that I am very passionate about. It's really been life-changing for me. So I'm really excited to get you on here and hear your story and share some perspective with our listeners.
Awesome. Glad to be here.
Yeah. So you have a really fascinating health journey that you've been on yourself. So I want to start there. Can you tell us a little bit about what you've been through?
Absolutely. So, and I know your health story too, and you've been through a ton also. And that's kind of how we got hooked up, I think, right?
Yeah.
Because it was like sharing battle scars.
Totally.
You know?
All about it. Yeah, the wounded healer.
Exactly. So, I mean, mine started when I was young, about age 13 or so. So I started having terrible pains all over my body, mainly back pain and things like that, which kept me from playing sports, which when you're a 13-year-old boy, that's a big deal, right? It's like, man, this is no fun. So I go to the doctor, they run some tests. I don't know what's wrong. Try some ice, try some muscle relaxers, do some PT. You probably feel better. So, okay, time goes on. Age 15, I started having headaches, which progressed into terrible migraines. Have you had migraines before?
I have had migraines, cluster headaches,
Not good, right?
Nope.
Like these were, like lock yourself in a dark room, fall asleep, and pray it goes away.
Totally.
Type migraines. So we go back to the doctor, right? Just like any person would, back to the doctor, run some more tests. I don't know what's wrong. Here's a migraine preventative, and here's a migraine abortive. And if anyone's had migraines, you know what those are. So it's a medicine to prevent and medicine once you get it to stop it. So here we are, all right, loading up the medications. Another couple of years goes by. Age 17, I get vertigo, so terrible dizziness on my birthday. And I hope no one's eating out there, but it was so bad that I ended up vomiting, and I ended up having this for years after. So it's just terrible. The sensation is the world is spinning around you and you can't stop it.
Yes.
It's horrible.
I've had it completely just disabling, really.
Yeah, for sure.
Yeah.
Back to the doctor, MRI, CT scans, all these tests, poked and prodded, and they're like, well, I don't know what's wrong with you still, but here's some more medications. And, oh gosh. A year later, age 18, I get hit with this wave of depression and crazy anxiety. Just crazy anxiety all the time. Just always on edge. And then I get this crazy gut pain / gas, constipation, diarrhea, just stuck in this whole cycle, all the time. And at this point, I'm like, all right, this kind of sucks right now,
Yes.
This is not fun. So we go back to the doctor, we end up getting an antidepressant and a couple other meds. So, age 18, I'm on, 5+ medications, horrible brain fog, fatigue, pain, can barely get through the day, and that's no way for an 18-year-old to live. But it's no way for anyone to live.
Absolutely.
We're meant to be healthy, I believe. We're not meant to be here sick and depending on medications and all this stuff. I'm not saying medications are bad. Some medications have their place. But, me being all these, it didn't fix the problem, right? So I had a choice there. I could either keep going down this road or I could try something else, And thankfully that something else came along, which was, these great doctors in my area I got hooked up with. And I shared this story with you, but they shared the story with me of, the body's made to heal. We're meant to be healthy. If we just take out the bad, put in the good, we can heal and repair. We can get back to health where we want to be. And I was like, that sounds better than what I've been doing.
What a beautiful perspective versus, I've been in the chair in the office where it's like, well, you just got bad genes.
Right.
It's not going to get better. Here's another medication,
right.
It's like, oh man, are you kidding me? So what a great shift in mindset and perspective there.
Exactly. Thank God I went that route, right? And so I did. I got hooked up with some other great doctors. I think they say you are the sum of the 5 or 6 people you surround yourself with. So thank God I did that. Ended up going to chiropractic school. Loved it. It was super stressful. So that kind of drained me even more. But then I got hooked up with this thing called functional medicine. And I think you talked about this before on the show, Amanda. And we talked about this a lot. And it's kind of something you practice too, right? It's all about getting to the cause of the problem. And once I did that, I found out all these things that were going on with me. I lost 55 pounds. I got off all my medications. I'm the healthiest I've ever been. I've got energy, and I can actually think and speak and remember names. It's like, wow, so this is what it's like.
It's a beautiful thing, right?
Yeah. This is what normal people feel like? Wow, that's great. So it ended up, I had a lot of problems in my gut, which most people do. But I had a lot of bacterial overgrowth. I had parasites. My hormones were extremely out of balance. My adrenals were shot from all this stress. I couldn't detoxify very well. So when I put all this stuff out on paper, you're like, man, I'm in rough shape.
Yeah.
But it's so empowering because you know how to fix it too, you know? So once I did that, like I said, everything just kind of fell into place. It was so awesome. And that's why I do what I do, because I get to do this with other people every day. I'm sure just like you, we talked about this, you're like, this is why I do what I do, because I get to help people like I was helped.
Right.
Same exact thing. It's so cool to see people come in and they've got no hope, right? The doctor said it's all in your head, or they have no way of looking forward.
Yeah.
And giving them just a little bit amount of hope, it can turn their life around. It's so cool.
Oh, hope
it's
is
so
a
rewarding.
powerful thing. Hope is so powerful, and
Right.
and yeah, just having somebody to really having a medical practitioner to listen.
That's huge. Yeah, so a lot of my patients, I'm sure some of your patients come in too, and they're like, well, I went to my doctor and they gave me 5 minutes, and I couldn't get out everything I wanted to say.
Yep.
And from my perspective too, I've been there. You have too, I know. But when you go to the doctor and you've got all these things going on, I think the average is like 7 minutes. That doesn't cut it, from my perspective.
Yeah.
And I know you do this too. I sit down with my patients for an extended amount of time to figure out what the heck is going on with them.
Yeah.
And you have to. Because you have to get that piece of the puzzle to see what are the certain factors in that person's life that's caused them to be sick. Because everyone's can be totally different.
Yeah.
Right?
Absolutely.
You could have problems. Let's say you go home and you've got an abusive spouse or something, and we didn't even ask about that.
Yeah.
That's a huge part of you have a job that you hate, or you're going home and you have mold in your house.
Right. Right.
All these different things. Or maybe you're just sucking down like 4 sodas a day. Maybe it's just simple, something like that.
Yeah.
So
Yeah.
That's the cool thing about functional medicine. It's personalized medicine, right? It's not about, random controlled studies say antidepressants work on 20%. I think it's like 20% of people or something it works on. No, it's what does Amanda need, in her life to make her better.
Yeah.
That's what's really cool about it.
I love that. That's so great. And I can, as you were talking, I can specifically recall there was a moment sitting with the doctor. I really felt like I was just falling apart, right? Like I'm sitting here thinking, what is wrong with my body? I mean, my life was going totally off the rails in my opinion. And, and I sat down and yeah, she said, with these acute visits, I've got 7 minutes.
Was
she
it 7?
said that to me. Yeah. And
Wow.
I'm like, well, that's great. I've got 7 autoimmune diseases.
Yeah.
So I'm going to need more than 7 minutes.
And that's the thing. Like, I always say this: conventional doctors aren't bad people. The system they're stuck in,
Totally.
it's totally broken.
Yeah, I'm absolutely, because this doctor to this day I have a relationship with her.
Yeah.
She's a wonderful person, but she's working within a system. And
Exactly.
that system is broken. So
Yeah. So what you have, you're based on these insurance, these company rules that you have to live up to. You have to see so many people an hour. We have to go through all this stuff, and it's not feasible to get to the root cause of people's problems, and it's really not.
no.
And there's a great movie called Escape Fire. Have you seen it?
No.
Oh my gosh, you need to see it. Write
Making
that
a
down.
note.
Yep.
Making a note.
But it goes through and it follows a few of these medical doctors that are frustrated with the system, and it follows them throughout the day.
Awesome.
It's fascinating. And one doctor was like, I think it was the patient had cardiovascular disease, and she was like, if I sat here face to face and we talked about a great diet and exercise and lifestyle, it would take me 30 minutes. I'd get paid like, $30 or something. I can't remember what it was. It was minute. She's like, if I go into surgery, put a stent in, I get paid like $2,500. So we're incentivizing the wrong things, right?
Yeah.
It's totally backwards.
100%.
Yeah.
Absolutely. So touching on functional medicine again, it's just a different philosophy, different approach in general. Can you kind of encapsulate that for us?
Yeah. What I tell people about functional medicine, a couple of things. One, when you go to your doctor, conventional doctor, and say, I've got symptom X, they say, okay, here's drug X. Overwhelming majority of the time, right?
Right.
And it's symptom-based. Functional medicine is based on the systems of the body and how they all interact. Your hormone system, your immune system, your detoxification system, all these, how they're interacting with one another, and fixing that. As I tell people, we're looking upstream. So another thing it looks at is the root cause of the problem. I'm sure you talk about this all the time. But we're not looking at, I've got low testosterone, here's testosterone. It's what caused that in the first place. You know, I've got 7 autoimmune diseases. What caused that in the first place, right? What broke down where, and how can we fix that and get back to balance and homeostasis so we can get healthy and stay healthy? Right. That's what it's all. And like saying this stuff, it just makes so much sense to me, and I know it makes sense to you. And when I tell this to people, they're like, well, yeah, that does kind of make sense. You know, I guess I have just been like treating symptoms, and like a light bulb goes off in their head. I tell people you've got a flood in your sink, in your bathroom, and it's your sink. It's just overflowing, right? What are you going to do? Are you going to go start mopping up the floor, or are you going to turn the freaking sink off? Like, guys, come on. Let's go back to the cause of the problem. Let's fix it. And I talk about underlying causes. It's the stuff we do every day. Are we stressing a lot? Are we exercising not enough or too much? Mm-hmm. Are we sleeping enough? What's our diet like? Are we able to detoxify? Do we have hidden inflammation and infections and all these things? I tell people we're like detectives, right? We're always looking at these underlying things that most people aren't looking at.
Yeah. Being a detective, and I'm big on people just being their own advocate, and what I love is that they can actually sit down with someone who is, I feel, also very much their advocate when they sit down with a functional doctor.
That's true, and it's empowering, you know.
Yeah.
The whole goal is to not only find out what's wrong with them, but teach them along the way. Doctor means teacher.
Yeah.
Teach them along the way these skills they need to get healthy and to stay healthy the rest of their life, right?
You
and
bet.
I'm sure you're great at that too. I know you are, and that's why we do what we do. Again.
Thank you. Those are big words coming from me. I really appreciate that.
Yeah.
Well, this is Amanda LaPlante. You're listening to Get Real to Heal on KWRHLP 92.9 FM. I'm here with Dr. Seth Gerlach, Core Health, and we will be right back after these messages. This is Amanda LaPlante. You're listening to Get Real to Heal on KWRHLP 92.9 FM. And we are back with Dr. Seth Gerlach of Core Health. Welcome. And let's dive into some different functional topics. I'm really excited to hear your perspective on a few different things
for sure
that you deal with.
Can I say one thing too?
Yeah.
You have a great radio voice. Like that intro.
Thank you.
I think you nailed it. And Get Real to Heal. It's great.
I love having you in that seat. I love it. It's awesome. So, very cool. Thank you so much. It's so kind. And likewise, you have some experience in radio.
A little bit, yeah.
You dabbled.
Yeah, I dabbled. Yeah, I like radio. Yeah. It's great, right?
It's a good medium.
Exactly.
Yeah,
you get to reach a lot of people and hopefully help a lot of people too.
That's the goal, right? Just get some good information out there.
Exactly.
Yeah. So talk to me about how you treat and address fatigue, because I get that comes up over and over with people.
Gosh, this is probably the number one symptom I see. I don't know, is it probably the
number one? Yeah.
It's so common, but it can be due to so many different things. That's the thing, you know. So when I think fatigue, you know, we get a lot of this out of the history. You know, we figure a lot of stuff out. But do we think it's something like an anemia, right? Just like this is something you go to your doctor and you get a blood test and they say, oh, you got anemia, right? Could be iron deficiency or B12. Maybe you're not getting nutrients or oxygen to your cells. That makes you tired, right? It could be things like vitamin D deficiency, right? Maybe we're not getting enough sunlight. Maybe we don't have enough vitamin D, which has been shown in studies to lead to lower energy levels. Right. Really kind of crazy. Vitamin D, side note, also has been shown to decrease 17 different types of cancers, or protect from 17 different types of cancers.
Wow, I had not heard that.
Isn't that wild?
Yeah, it is.
And it's free. You can go outside and get it from the sun. How crazy.
Right.
Most people are so sun deficient though, right?
That's
we work inside. We don't go outside a lot, so...
And when we do go outside, we're all so concerned with cancer.
We put on sunscreen.
We're putting on so much sunscreen, and it's like, a little bit of sun is a good thing.
Yeah, those short bursts, you know, like 15, 20 minutes of it's so great for us. So
Absolutely.
Fatigue, adrenals can be another huge sign of fatigue. So our adrenals are, they help us with our stress response, right? If we rely on those too long, then we can be fatigued because all of our other hormones will start to suffer, right? Our cortisol can be out of balance. And that can throw off our estrogen and progesterone. Those can lead to fatigue also.
Right.
Even things like simple, are you getting enough sleep? Are you waking up while you sleep? What's your sleep environment like, right? Exercise. Are you exercising? Are you not exercising? Are you exercising too much? Are you exercising not enough? I see both sides. There's so many, like nutrient deficiencies are huge. If your gut is damaged from, let's say, medications or stress or like infections, you're not going to absorb all the food you need in order to give your cells the nutrients they need to make energy. So that's one simple thing I do. I always make sure we're people's guts are, back in shape again. So we can digest and absorb all these nutrients so we can actually make energy again. It sounds super simplistic, but most people don't look at that. Um,
They don't. And what's so fascinating to me is, Hippocrates, what, a couple thousand years ago?
yep, all
All
disease.
health starts in the gut.
For sure.
Yeah.
And I find that a lot. Everything kind of circles back to the gut. Up to 80% of our immune system's in our gut.
Serotonin.
Serotonin,
Yeah,
90% that.
neurotransmitters.
Absolutely.
A lot going on in the gut there. So.
Yeah, so much stuff is in the gut, which we can talk about anxiety and depression too.
Yeah, let's touch on that.
That flows right into that.
Okay.
So the gut and the brain are intimately connected, right?
Mm-hmm.
So I always tell people, if you've got a fire in your gut, you've got a fire in your brain.
Yeah.
When we form in the womb, our brain and our gut are connected via nerves, and they're still connected today.
Right.
How crazy is that? And like you said, we make our neurotransmitters, almost all of them in our gut, so that's going to affect our brain. So if our gut is super inflamed, or we've got these parasites or bad bugs, H. pylori, we're always creating this inflammatory environment that our brain's going to reap the bad benefits of.
Yeah.
I've seen it so many times. People come in with like brain fatigue, crazy anxiety or depression, and all we're doing is cleaning up the gut, and all those symptoms kind of fade away, right? So, well, it turns out it wasn't an SSRI deficiency. It was a deficiency in what's going on in my gut.
You mean I don't have a Xanax deficiency? That's not.
Isn't that crazy?
Oh, okay.
It's kind of crazy how that works, right?
Yeah,
But,
it just makes sense.
yeah.
Yeah.
And anxiety and depression, it can be other things too, right? Toxins. If you can't detoxify very well and you're exposing yourself to toxins every day,
Yeah.
that's directly toxic to the neurons in your brain.
Mm-hmm.
And that does not bode well for your mood
Right.
or your energy levels, right?
Right.
So many different things. So I always go through, and I know you do too, clean up your environment at home. What are you exposed to? Your water, your air, your food, the things you put on your skin. Everything you put on your skin, it's going to go through, absorb into your vital organs in less than 30 seconds.
Yeah, I mean, we think about like people don't always take into account if I'm smearing lotions and potions all over my skin, all of those chemicals and other things are getting absorbed into your bloodstream. One of the most effective ways to get any kind of medication, or you think about like a nicotine patch is a good example for people. It's like, yeah, well, what happens? You put that on there, it absorbs through the skin. Think about that.
Yeah,
think about that
isn't that
process.
crazy?
Yeah, people miss that.
So I tell people, don't put anything on your skin you wouldn't put in your mouth.
Right.
Isn't that wild though? Like,
Same
I
here.
never would have thought of that. Like
Yeah.
growing up, but
No,
it's...
oh my gosh, I love some Bath and Body Works, and I remember somebody once said, I was putting some of the lotion on, and he said they can make like chemical warfare, like chemical bombs with that stuff.
Bath
It's like
bombs.
you can smell it like way across the office. I mean, it was, yeah. Now I think back, and I'm like, oh, whew, yeah, who knows,
Not good.
right?
So another thing I see a lot is hormonal imbalance.
Right.
So we can talk about, adrenals are kind of our foundation. If our adrenals, we go back, that's our response to stress. If we relied on those for so long, or we've got these other inflammatory things going on in the body, those are going to suffer, which brings down all of our other hormones, like our testosterones, our estrogens, and our progesterone can be out of balance too. So that's a big one, and helping people balance those again is really one of the first steps I feel in building people up before we start doing other things. So getting them back on the solid ground first,
Right. Yeah, I know after getting some of my inflammatory issues in check, right, figuring out some of the root causes of my autoimmune diseases, I really was in severe adrenal fatigue. And going through the process of starting to repair my adrenals was very interesting.
Yeah.
That's some serious work.
It's super important, and it's super common.
Yeah.
People don't know this stuff.
Yeah, absolutely. And I still to this day have to be careful about how hard I whip that horse, you know what I mean?
Right.
So
for
like
sure.
I'm having a little bit of coffee today, but if you could see my cup, it's like this full. And it's all about keeping things in balance and getting in tune with your body to know what you can and can't handle. And that's the great thing about a doctor that does what you do, is that they'll actually teach you how to do that.
Oh, exactly.
So,
Yep.
yeah, and likewise, I do the same thing
Exactly.
when I'm working with people in support. Yeah.
Yep.
So okay. So hormone imbalance. So what are some of the other things that you can do? And I will say, so I had some progesterone, testosterone, some other issues when those were out of balance. It's amazing how many different things they can throw off.
Mm-hmm.
So yeah, digging into that a little deeper.
Yeah, so that can cause all kinds of symptoms. So if your progesterone or estrogen are out of balance, you can have things like infertility. You can have things like mood disorders, mood swings, anxiety or depression. Your immune system will be off. You can have other female issues. We could have low sex drive, right? That's a huge one I see in the elderly, or not elderly, but just people getting older,
Sure.
right, as they age. I had someone today in her like mid-40s, and her sex drive just shot, right? And it can come full circle from all these other hormones, right? And so putting people on a good diet plan is essential for these people, right? Making sure they're eating every 4 to 5 hours, because the adrenals help regulate our blood sugar also. So if we're going too long without eating, or if we have a lot of sugar in our diet, that's going to be very erratic, and it's going to put a lot of stress and strain on those adrenals. That's really big. Other things like adaptogenic herbs can be really big, or glandulars, or even using really tiny doses of pregnenolone and DHEA to kind of reset the brain adrenal loop. Really, really big. Right? And toxins can be very big for these people too. Getting those out of the home, very essential.
Absolutely. I want to touch on the adaptogenic herbs. Haven't talked about that in the show before, but that's been really great for me too. We're talking like ashwagandha and some of those others. Can you tell a little bit about that?
Yeah, I tell people simply it's like a thermostat, right? You set your thermostat between 68 and 72. And when it gets too hot, your AC kicks on. When it gets too cool, your heat kicks on. That's why I tell people these are like for your stress hormones and your body. If you're really stressed, it can help your adrenals and your brain kind of ramp back down. If we're kind of in the dumps, it can help speed up and balance those hormones a little bit better. That's kind of the simplistic way. I like to talk in simplistic terms because people understand that, right? So that's how I kind of describe that.
Yeah, that is what makes a good doctor/teacher, right?
Perfect.
I mean, break it down.
And I take those, like if I'm traveling, I'll take those with me because traveling's a stress, or if I feel like I'm starting to get sick. Just for a little extra support here and there too. I think they're great.
Yeah, absolutely. So I want to touch, we've just got a few minutes left, but autoimmune diseases, right? Just kind of wanted to touch on some of the ways that you help people with that. And I think we've kind of already touched a little bit on that throughout the show, but anything else you want to add?
Oh, it's so big. And I was just reading something today that I think it's 50 million, they think Americans, I've heard up to 100 million Americans potentially have an autoimmune disease.
I wouldn't be surprised by that. I'm shocked at how many people I run into with rare diseases these days.
Right, and it's mostly an underlying immune issue, right? And so with autoimmune disease, we look at a couple of things. We can't change your genetics. I'm sorry, I can't do that. But the other things we can do is we can look at how do we balance the immune system. Most of the immune system's in the gut, right? We've talked about this, but it all comes back to the gut. And then a lot of times there's that one stressor, the straw that broke the camel's back, that pushed us over the edge.
Right.
Like, I got a divorce. 1 year later, I had fibromyalgia, or I had a baby and it flipped me into Hashimoto's. Right? There's like that one thing. So a lot of times for people, it's like a hidden chronic infection. So we had a lady come in with Hashimoto's. That's autoimmune thyroid disease, and she had constipation, anxiety, hair loss. I can't remember, like a few other things, but we did this. We found out she had underlying parasites, and her adrenals were so out of balance. Once we fixed that, all of her symptoms went away. You know, I'm not like a witch doctor or anything, but once you get rid of the bad things in the body and rebalance it with good stuff, the body can heal. It's super cool.
You know, and people squirm and get all, squeamish whenever we talk about parasites or candida or any of that stuff. Well, you know what, guys? It's real. It happened to me. I'm just saying, like, we are animals. We are mammals. These things happen. So true. Anyway. So, okay. Well, thank you so much for coming in today. Dr. Seth Gerlach, Core Health. Can you tell people how they can get in touch with you? Yeah, easiest way is our website, corehealthstl.com. There's so much information on there if you want to check it out. Absolutely. Yeah, great resources, and thank you again for coming in. Thanks for having me. This has been awesome. Oh, yeah, let's do it again. For sure. Awesome. This has been Amanda LaPlante. You've been listening to Get Real to Heal on KWRHLP 92.9 FM. For more information about my health coaching services, or to contact me, or to listen to back episodes of this show, find me online at amandalaplante.com or on Facebook at Get Real to Heal. Awesome. Yeah, totally. Thanks for having me.